The nurses and providers have collaborated to improve the A through F bundle. Our goals are to consolidate the bundle while still including vital nursing-specific information only. A, C, and D should all be combined at the beginning of the bundle: pain, sedation, and delirium. For example, is the patient in pain and how are we treating it? Is the patient pain controlled? Are we sedating the patient, and when is the sedation vacation going to be completed? Finally, are they delirious? Remember to try to only use the CAM ICU assessment scale when describing delirium. Next, if the patient is intubated, have we performed a spontaneous breathing trial yet? If extubated, try to only include how much oxygen they are on and what incentive spirometer volume they have achieved. For mobility, please quantify their progressive mobility continuum score 1 through 4. This will be attached to the video. What will their mobility goal be today? Also to be included in mobility, please say if the patient is in restraints and if the order needs to be renewed. Finally, for their family, who is the POA and when were they last updated? Skin and nutrition should not be included by the RN during the A through F bundle. It will be talked about by the APP during their presentation of systems. Nurses are empowered to participate in the multidisciplinary rounds if information needs to be added. If appropriate, ECMO cannula lengths should be shared by the nurse during the cardiovascular section of rounds. Plans for turns and baths of ECMO patients should be made with the APP prior to rounds starting, preferably during the pre-rounds. Your first turn should be completed in the 9 o'clock hour.
We will now present two examples of what an A through F bundle should include. Bundle 1 is for an intubated and sedated patient. Mrs. Doe has a nonverbal pain score of 3, with frequent grimacing. For pain and sedation, she is on a fentanyl PCA, 50 mic continuous, 25 bolus, Q6 minutes, max of 300 mics per hour. Her ketamine PCA is at 50 milligrams an hour, and she's on 1.5 of Dex for a RASS score -3 to -2. Mrs. Doe is CAM positive. The daily sedation vacation in SBT was completed this morning. After 10 minutes, the patient was tachypnic and agitated. Sedation restarted and placed back on full ventilator support. Patient mobility score is currently a 1. She is on strict bed rest while on VA ECMO. We will use the ICU ECMO turn schedule to turn the patient every 2 hours. The patient is in restraints and that order needs to be renewed. The POA is her daughter Emily. She was updated by the team yesterday and calls to speak with the bedside RN frequently. Example 2 is for an extubated patient. Mr. John Doe complains of 6 out of 10 pain this morning at the MSI site. He uses his fentanyl PCA 020 Q6 max of 200 about 5 to 6 times an hour. He also has scheduled lidocaine patches and 500 milligrams of acetaminophen Q6. No sedation is being used. Mr. Doe is CAM negative. He has met his O2 sat goal of greater than 92% on 3 liters nasal cannula. He achieves 500 milliliters on the incentive spirometer. His progressive mobility score is level 3. He stood and pivoted out of bed to chair with a 2-person assist. PT-OT has been working with him. The POA is his wife Tracy. The patient did a FaceTime call with her this morning. She prefers to be updated by the team after 3 p.m. when she gets home from work.